Hello, everyone, and welcome to today's WIN webinar, Trends and Innovations in Developing Nutraceuticals for Women. My name is Traci Kantowski, and I am the programming co-chair at WIN, and it is my absolute honor to be able to host today's webinar. We have some really great experts lined up for you and a lot to cover, so we'll go ahead and dive in. I just want to start with some brief info about WIN for any of you that aren't already familiar. And if you're not familiar or you're not a member yet, we encourage you to join. We have a really strong vision to achieve economic and social equality in the global nutraceutical industry. Our mission is WIN offers tools, networking, visibility, and mentoring to create an environment where women have an equal place in the leadership and evolution of the global nutraceutical industry, and where they can reap equally personal fulfillment, social and economic benefits. And you'll notice here in this picture that we have both men and women in the picture. And that's because at WIN, it's really important to us that we all work together as an industry. If it's only women going in this direction, it's not going to work. We need to all work together. And so we're really honored to have so many men as a part of our membership as well. We have 4 core focus areas. Leadership, we want to increase that number of women serving in those leadership positions. Growth, specifically in the area of science and research, we want more studies about women. We want more studies led by women and more funding for research on women. For investment, we want investment opportunities for female businesses to help that grow, and to ensure better opportunities for rising female leaders, because we need the next generation to come up after us to continue the growth and build that equality. Couple quick housekeeping items. This webinar is being recorded and it will be posted in the WIN member portal. If you have any questions, we are going to try to answer as many of them live as we can. We had some come in advance, but you can use that QA box on your screen to type in your questions and we'll do our best to answer them live. For the chat, you can use the chat if you need any assistance with technical issues. Kim, my co-chair, is on the back end and she or I will help you with any issues that you need assistance with. So now I'm not going to call all our panelists on yet. We're going to invite Marit Veenstra to come on with me. Marit, if you, yep, there you go. And she is a brand strategist at HMT, which is a European firm, does a really great job helping brands and does consulting as well. I'm going to stop sharing my screen and I'm going to turn it over to Marit to share hers and kind of tee up this topic for us. And then we'll bring the rest of our experts on to have a really great discussion. Take it away, Marit.
Perfect. So Traci, first of all, thank you so much for inviting me to speak here. So hi, everyone, and thanks for joining. My name is Marit Veenstra. And as Traci said, I work as a brand strategist for HMT, which stands for the Healthy Marketing Team. And today I'm going to talk to you about a little bit what is happening in the area of women's health, where to play and how to win, because we see that this market is really evolving and that more and more products are being launched on the market. So it's really to understand how can you create a good positioning and how can you target the right consumer, because no woman is the same, as we all know. So a little bit about the HMT. So we are an international expert agency for innovation, marketing, and branding in the area of food and health. And we've been around since 2007. And what we focus on is really consumer insights, brand strategy, innovation training, and we also have creative services. So as I mentioned, we've been around for quite some years now, so around 15 years. We have worked in more than 60 countries with over 500 brands, both B2B and B2C, but really in this area of nutrition, foods, and supplements. And we really work together with change makers who bring new innovations, science, and technologies to market. And here you see a short list of some of the clients that we have been working with over the past years. And I think one of our favorite clients this year has actually been Traci, and we've been working with Cypress Minerals as well. And it's been really lovely to work together with everyone in the team. So yeah, let's dive into the topic. So I'm going to start with showing you a little bit of an evolution of the women's health category. So I think we all know, I don't know how many women are listening here and how many men, but I think we all know that, especially I think in Europe and the US years ago, well, still a little bit, but a lot of topics around women's health are being silenced. And women's health has been really seen as a taboo, which is luckily changing now. But this is where if we talk about periods, well, that was not really possible. We couldn't really talk about it because it's a little bit a shameful topic. And if you have symptoms when you have a period or any other thing that's happening, all your symptoms are kind of considered normal. And yeah, you just have to deal with it. You go to the doctor. Yeah, the only treatment that they give you is a hormone treatment, which seemed to be the only solution. Then also we have the society that shaped us in a way like only skinny is beautiful. We all know that that is not true, but we see how women's health has really been impacted by the society. Now, luckily, this is changing where we go from women's health is silence to women's health is empowering, where actually now, luckily, in most countries, not everywhere yet, unfortunately, but where this taboo around women's health is really disappearing. And this is where we actually start to understand that having all these symptoms is not normal and we should not ignore this, but we can actually live in, we should actually aim for holistic well-being, and we can approach our health in a natural way, and we don't have to rely on all these hormonal treatments. And luckily, also the fashion industry is responding to this, where they're not only using very skinny women anymore, because it's just not the realistic world and it's not how we have to be. It's important that we can be who we are and who we want to be as women. And I think it's really beautiful to see that that shift is finally happening in the industry. But this also shows that there is not one consumer, because every woman is different, and the way we are experiencing our life, the way we go through our different life stages, symptoms that we are having, or when we go through menstruation or menopause, it is very different, and every one of us will experience it differently. So this is also when you launch a product or when you launch a brand, it is really important to understand that there is not one consumer. And this is why we have to take a very targeted approach. So that's what I will focus on today. So today I will share with you 4 key consumer segments in the women's health area with 4 different needs. So I will show you the medical needs consumer, the lifestyle consumer who wants to aim for a positive change in her life, the consumer who maybe doesn't want to change, but is seeking better for me solutions. And we also have the consumer that doesn't want to change at all, doesn't just want to stick to traditions, but of course still probably needs some products once in her life. So I'm going to go through these consumers and show you how you can, who they are and how you can target them. So yeah, so we have the first consumer. So as you can see, this consumer is in a lot of pain. This consumer has a medical need because something is wrong. And this is usually where a consumer is diagnosed by a doctor. For instance, atherosclerosis, osteoporosis, endometriosis, cholesterol, or maybe a high blood pressure. So really a medical need diagnosed by the doctor. What is important if we want to reach this consumer with our supplement or even a food product, it is really important that you can show that you prove the effect that your product gives. So the benefit, it is very important to prove the benefits. And this consumer, we really need to target them with rational communication and branding. And this also means that as a brand, you have to heavily invest in science and education, because it's so important that this consumer knows that these products work for them. And this is also where endorsement of the doctors community or a scientific community can help to build this credibility. So how can we win this consumer? With scientific proof, clinical studies, and preferably health claims. So here I have an example of a product, and it's written in Spanish. It's because I live in Spain, so it's a bit more easier to find Spanish examples, because that's what my Google algorithm shows me. But anyway, it's about the idea also of this product. So you see that this is a product specifically focusing on lowering cholesterol. And it is backed up by clinical data. And I think what is really good here is that it also clearly shows in a simple way still, but a mode of action, which usually really helps to explain the story for this consumer. And it's all about understanding how this product can fit their condition, and improve. So it's kind of like treating. I know we're not allowed to say that, but it's kind of going that direction. So that is, so I think a good thing to add here is that, as we see, this product is not specifically focusing on women. And I think especially in this more medical need area, this is where we see a lot of gaps, and where products are not really targeting females specifically, which probably also has to do with the scientific research that's being done. That would be interesting to discuss later as well. But yeah, so I think there's still a clear gap for these specific products that target women. Then we have the lifestyle consumer. So this is the consumer that wants to have a positive change in her life. And maybe she doesn't have a specific need or a specific medical need, but she wants to constantly improve her life and is really aiming for self-optimization. So this is the early adopter of trends and the consumer that only wants what's best for them. So to reach this consumer, it's really important that the product fits her lifestyle. It must be trendy, must be new and different, and really aligned with her values of nourishing her body. So it's really more a lifestyle approach that you're selling. So that also means that you sell a product, but it's important to give this experience beyond the product. So you can really become their life companion, let's say. So to win these consumers, it is really important that you tap into a new belief and that you use emotional storytelling to bond with them. And the example that I'm showing here is called Holistic, which is a Spanish supplement brand for hair and beauty, but they focus specifically on hair. So what you see here is that they really tap into this new belief of what if you start taking care of your hair in a different way? Because actually, most of us, the way we take care of our hair is not healthy, is not helping our hair. And we take care from it from the outside, right? With shampoos and creams. But what if we take it from a different point of view and we actually start strengthening our hair from the inside? So that is really how they approach this and how they want to bring this new belief to the market with this supplement. You see they use natural ingredients and also the way that they show the consumer experience. So it's not so much focused on science, but more about how the consumer is experiencing the product, as you can see in the picture, which is a really good way to connect with this lifestyle consumer. Then we have the consumer that wants better for me solutions. So this consumer is mainly driven by convenience. So they maybe they don't really want to change, but they need things that make their daily lives easier. So how we can reach them is more like, okay, does it fit their daily routine? Does it make their daily routine better? Is it easy to make a healthy choice for them? And is it easy to understand? So for this consumer, we must really focus on well-known ingredients and easy to understand benefits. And then if we look into a brand example, we see that this brand Ollie, which is a US supplement brand, they really focus on these very common symptoms that women have. Like there are some around menopause, one is around vaginal health, and one is about bloating. So these are really key issues that the consumer is having. So what they do really well is that they use really easy to understand communication and benefits. And also in terms of the ingredients, they don't go into too much detail what is actually in there, but it's really about the benefit that you get from it. And it's easy to put into your routine with all these different solutions. Then we have the last consumer. And as I mentioned, this is the traditional consumer, the one that doesn't really want to change. They really care about their normal routines and their own traditions. They don't really want changes in their life. So that also means it's more difficult to target this consumer. So this is really the typical mass market consumer, where they are really price focused. They don't want to change their habits. And for them, food and taste really come first. So to win this consumer, it's important that you don't talk about things that are too new. Don't use ingredients that are too new, but just connect to what they know and what they love and make it very simple for them. So this is where we have a very mass market brand, a brand that almost everyone knows. So this is Centrum, and they have all these different types of supplements. But we make it very easy for them by giving them all the benefits in one, so they don't have to take all the different supplements. It's even in a gummy format, so it's also tasty. It feels like you're eating a candy, so they don't have to associate it with maybe medication. So we make it very simple for them. And also when you look at the benefits, it is all very simple, and it's things that they might be looking for. And the fact that it's recommended by doctors also helps to build that trust, and the fact, that it might be good for them. So I hope I wasn't too fast, but I think this can really help you also to understand if you're launching a new innovation for women's health, to understand that there are different consumers. And of course, these key segments, we can segment them even further. But this is just also for you to have an understanding, what are these really core segments that we play with. So also the blue and the green segments, I would say they are more niche, where you can introduce newer ingredients, newer products, newer formats, also where the prices are a little bit higher, so it's more premium. Whereas the yellow and the orange consumer, it's more mass market. So this is where the prices go lower, where you have more competition. So it's changing a little bit on where you play. And I think my key takeout here is, remember that no woman is the same, and that there's no one size fits all. So understanding your consumer is really key to be successful in this market. So that was my presentation, and I want to thank you for that. If you have any questions, we can discuss it now, or feel free to send me an email. And I've added here a supplement report that you can download for free. We don't go specifically into women's health in this report, but still I think it's an interesting one, because we also show some consumer data that is quite interesting to see how actually consumers are now where there's really a gap in the more mental well-being space. So I think interesting if you work in this area. Thank you.
Marit, thank you so much for teeing that up. And I appreciate that you provided some examples, because I think they also really show tremendous opportunity in this market for us to continue to improve. And so I'm going to invite our other experts to come on. Chris Lamb, who is the VP of Commercial Strategy at Cepham, Danielle Masterson, who is editor at NutraIngredients USA, Devon Gholam, who is VP of Science and Innovation at Step Change Innovations, and Linda Alvarez, who is the CEO and co-founder at Levelle Inc., which is a brand. Let me just help Danielle make sure we can get her camera on. And then we will go ahead and start the discussion. I'm going to stop my screen sharing so everybody can see all of you. All right. Well, welcome everyone. I'm thrilled to have you here. And as we talked about early on, I kind of invited you all because you bring different perspectives within the industry, which all are really important to help formulate proper products and to market and position them, et cetera. And Marit talked a little bit about that positioning. But before we go into some other questions, I'd really like you to just share a little bit about yourself and kind of what your role is in this space. And I'm just going to go in alphabetical order. So Chris, why don't you kick things off for us?
My name is Chris Lamb. I work for Cepham Inc. Cepham, as far as an organization, we're a science-driven ingredient manufacturer that our commitment is to put our partners in a position to develop sustainable self-care solutions.
Thanks, Chris. Danielle, over to you.
Yeah, thanks for having me, Traci. My name is Danielle Masterson. I'm the editor at NutraIngredients USA. We are a trade publication for the dietary supplements industry. I host a podcast called the NutraCast, and I also host a weekly series called Nutra Women Wednesday.
Yeah, thanks, Danielle. And if anybody has not checked out Women Wednesday, the women that Danielle features are just incredible. I love listening and hearing their stories every week. She's really done a tremendous job helping position women in the industry. I also need to give her a little nod because Danielle was just a recipient of one of our inaugural WIN Awards at Supply Side West. So if you were there, kudos to Danielle for that Champion Award and all the work that she and also Stephen Daniels has supported as well over at NutraIngredients USA. Our industry is better because of you guys. So thank you.
Thank you.
Devon, Gholam, please.
Hi, good morning. I'm Devon Gholam. I'm Vice President of Science and Innovation at Step Change Innovations. We are a very fancy consultancy. My boss is going to kill me for saying that. But we really help with ingredient suppliers, helping with sales and commercialization of science-backed branded ingredients. And I'm a food scientist by background, and I do a lot of work with different ingredient companies, figuring out what ingredients work and what applications. And Traci invited me here today to represent formulators in this discussion.
Yeah, thanks, Devon. And also, Devon is really open about her own journey as a female in this area. And so if you want somebody who's like researched the heck out of ingredients and which ones work and which ones don't and how to formulate, like Devon's your girl. And is a great follow on LinkedIn because she shares that journey all the time. And I really appreciate your openness and your like vulnerability, Devon. Thank you for being a really good example for all of us.
Thank you.
Linda, please share a little bit about yourself and your company.
Yeah, thank you so much for having me, Traci. I'm Linda Alvarez, co-founder and CEO of Levelle Nutrition. We are the first and only sports nutrition company in the US focused specifically on women, which is really exciting. I have a background as a family physician. Was never planning on starting a food company, but in seeing the massive gap in women's products and also hearing from women that they had just been suffering from so many of the products on market, it really drove my co-founder and I to start Levelle, and that's us.
Love it. Thank you so much, Linda. And I think that's actually how a lot of companies, we're starting to see more of that too, of people are innovating or starting their own because there are gap areas. So Marit actually showed an example of Cepham, and Cepham has been around a really, really long time. But the reality is that they haven't, I mean, they are a good company for the mass market, but they really haven't invested in that female-led research. And so it's really important to have companies like yours, Linda, doing that work and helping support women in the industry. And I'm super grateful. So we're going to jump into a couple questions, and I encourage all of you online, please feel free to submit your questions in the Q&A box. We'll try to get to as many of them as we can live. If we don't get to your question, I will send it out to our panelists, and hopefully we can get you some responses that way. But we're going to try to get through as many as we can. So Devon, I'm actually going to start with you. And I just am curious from that formulation perspective, and I anticipate Chris and some others will have some stuff to chime in here as well. But what are some of the most challenging aspects of formulating for this market? And Lynn, how can we overcome that?
Sure. So I think one of the biggest challenges Marit did a really excellent job of illustrating is that women are not a monolith. We are all at different phases of our lives, and even if we're at the same phase, we may have different needs. So trying to drill down and define what your product is and what you want it to do is one challenge. But the other challenge, especially from the formulation side, is finding products and ingredients specifically that have clinical trials on women substantiating their use. There is a huge data gap between data for men versus women, and we have different physiologies, and different ingredients may impact men differently than women. So we really need to get more science on women and get more science by women. So that's why I'm here as part of Women in Nutraceuticals as well, just to really help promote women as a whole. We need more women in the STEM fields doing clinical trials, and we need more women participating in clinical trials to get that data to validate why we would put ingredients in the first place.
And to Devon's point, if I can jump in, it's not only that women are different than men. We're not small men, which was something that the industry would like to say or think of us as.
Pink it and
But
shrink.
yeah, right? Shrink it and pink it. But aside from that, as we go through our different life cycle phases, our hormones change, our physiology changes, our macro and micronutrient metabolism changes. And I'm so excited to see that there's more research coming forward towards that end. But there's so much more work to be done. Like, for example, it's, I think, very scary for companies. I'm pregnant right now. It's hard to find a lot of research that backs products that are focused on pregnancy or on breastfeeding, for example. Women, who go through menopause, it's a sad truth, but we outlive men. So you have women that are 45 to 85 plus that are just being ignored a lot of time in the research. And if we can really start to incorporate that in and have products that speak to those groups of women, we have such an opportunity within the nutraceutical space.
Yeah, amen. And, Devon and Linda, you both referenced research. And I'm really curious, Chris, Cepham, one of the things that stood out, and you guys do a really good job, is you recognize that there was a gap in research on the specific ingredients on women. And that's an area that Cepham has really stepped up its efforts in. And I'm hoping you can share a little bit more about why that's been a smart move, right? And just share a little bit of that info and what you
It absolutely is. There's historical gaps in research. As Linda had mentioned, yeah, historically, women are treated as small men. And it's not just the supplement space, it's pharmaceutical research. An interesting stat that really opened my eyes is if you look at the US population, 51% is women. Participation in studies of women participating in studies is about 25%. There's a huge gap there. And that was really the genesis of where we jumped in to really push our research forward. I'll say this, we've been very involved in women's health for 10 years. Our first product that was really focused on women was something that was created when our founders had a relative who was suffering from PCOS and created a supplement 10 years ago that we don't have to get into mechanism of action, but it actually naturally helps with PCOS. And our research now is we're truly working on gender-specific solutions and supporting that with research. And I think we'll probably talk about research a little bit heavier later on, but it's when you're looking at women, men and women are different. I know that's news to all of us, but fundamentally the physiology is different. And you have to design a study to lead you in a direction that's going to give you results that are representative of the population you want this ingredient directed at.
For sure.
To piggyback off of what Chris said, one of the challenges with testing women in clinical trials, or at least it's thought of as a challenge, is just hormones and how the variability over our cycle or the risk of pregnancy, because no one wants to be responsible for any adverse effects in a pregnant woman. That's horrible. So those are thought of traditionally as challenges when it comes to designing clinical trials, but I like to push the idea that we can look at them as opportunities, find ways to account for that hormonal variability or find ways to subsegment your data for different parts of the cycle, have greater participation in clinical trials and have more data to help decrease the variability. Look at those as opportunities to get that data so then we can make solutions that are more tailored for women's needs at that specific time.
Well, I love that. Oh, go ahead, Chris.
No, I was going to say, Devon, you bring up a great point. And when you're designing, we're in the supplement industry. We are here to commercialize things and make money. But sometimes as you're designing a study, you have to push your commercial aspirations aside a little bit in terms of timeline. So if you're researching something that happens every 28 days, traditionally you may run a 56-day study. That's based on the physiology of men. Women, you have to run it out 6 to 12 months, which on the commercial side, it delays your launch, but your study is worthless unless you capture meaningful data. And sometimes you have to run it longer.
Absolutely.
And frankly, that's something we ran into very recently.
Not
And
every woman has a 4-week cycle.
yeah,
I 5 weeks myself, so just even that variability needs to be accounted for.
and you need to capture as much of the timeline as possible. 56-day study, you may only get data on one cycle, which is it statistically significant? Probably not.
No, I think that's super important. And Devon, I love that you said that we should look at these challenges though as opportunities, because then when you get it right, you kind of make magic. And Danielle, I know a lot of science comes across your desk and you're hearing from brands all the time. Have you seen any studies recently that have really excited you in this area?
There's been a few studies that definitely have caught my attention. And yeah, I mean, we talk a lot about women's health. I get a lot of women's health things in my inbox. And as much as I appreciate all this well-deserved attention, it is hard to get science and different things to stand out. It's kind of like saying, calling something sustainable. What does that mean? How do you differentiate yourself from everybody else? So when something does stand out, I do get excited. I interviewed Linda from Levelle at Supply Side West because her product stood out to me. Levelle is one of the first, I think she said in the US at least, maybe anywhere that I've heard of that leverages our cycle. And its star ingredient is Helena's new human lactoferrin equivalent ingredient, Farah, that's got a lot of great science behind it. Definitely excited when I saw that. So I interviewed Helena's founder. I've talked to Linda about it. And, Levelle checks all the boxes. It's got the X factor. And I'm glad she's here because Levelle is a great example of a brand that's doing it right, and that excites me. Beyond that, I think we've done a really good job the last few years making, periods less taboo, raising awareness about things like menopause. I think now we have to take those conversations up a notch. How do we do that? I think the best way to do that is to elevate the conversation, to bring in the science. And the science needs to be done. It needs to be done on women, A, and B, women in that age bracket, whatever the product is being marketed to. So if you're talking about perimenopause, you want it to be the science to be done on women who are in that phase of their life.
For sure. And I think, some companies, you run the risk of, or some people are hesitant to do it, right? Because it takes, as Chris mentioned, it takes a little bit longer. But if you miss the mark and you launch a product that has no backing behind it or isn't helping people, then you fall flat anyway. Like
Yeah.
you're going to lose money either, you know what I'm saying? Like in my opinion, you're going to lose money if you're not doing that correctly from the outset. So
We're the decision makers. I mean, women make most of the shopping decisions for things that come home, whether that's food or supplements or nutraceuticals. So if you can invest the time to make a product that truly works for us, we will be loyal to you and look for your brand name on other products as well. So it makes good sense to target women.
yeah,
And
for sure.
And I think
go ahead.
too, oh, sorry, I was going to
No,
say,
go
I think
ahead.
to that point, and thank you, Danielle, too, for mentioning us in Levelle. But, something that we really focused on, and I think Marit actually did a great job of honing in on in her discussion, is focusing on a beachhead market and speaking to them. So we took time to actually, our first kind of main customer demographic were women marathoners, women that were running at least 2 half marathons a year, were really suffering through different GI side effect profiles. And even before we had a product, the time that we spent getting to know these women, understanding their challenges, made them advocates for us. So that way, as we were starting to get product out, they wanted to push that product forward. They wanted to be lighthouse customers for us, meaning like they were willing to like shine bright and say to everybody that they knew, hey, this is an amazing, product. I've had great success with it. I've seen them from day one try to understand what was wrong with the symptoms that I was having and how to fix that in products. So I think too, don't be afraid to speak with your customers. I frequently say my hypotheses are wrong like 85% of the time. And it's better to get that out early through customer interviews and discovery rather than after you've already formulated a product and have gotten it out into market. It's a lot less expensive, tell you.
No, for sure. And I appreciate you bringing up the positioning and some of Marit's information, because we've actually received a couple of questions related to positioning. So Marit, I'm hoping you can kind of weigh in. A couple of people have asked about, like, Linda did a really good job, and I appreciate that, Linda, that you honed in hard, right? Like, we want women who have run at least 2 half marathons, like, in the last year. Like, you really honed in on who is our market. And just as a quick sidebar, I feel like anybody who is helping runners should really, like, sponsor the porta potties at races, because there are so many digestive issues. And I've always thought you can make a ton of money if you just put your advertising on the porta potty. So that's my, like, marketing tip. But anyway, but Marie, related to positioning, a couple of people have asked in sort of different ways, but can you cross market this? You have mentioned 4 key segments. Can you cross market to more than one segment? Or is it really more effective to do what Linda did and really hone in, which sounds like perhaps that is the best? Or alternatively, position the same ingredient, which I think is a similar question, like position the same ingredient for different consumer segments.
So yeah, and I think here we have to also understand, like, whether it's B2B or B2C. But I think anyway, it is really important that you have to understand, first of all, what is it that makes your ingredient and your product unique. So I think one question was more related to the ingredient, right?
Yes.
And I think it is really important to do understand what is your core. And when it comes to your positioning as a brand or as a company, it is important to kind of choose your positioning. So you are either a brand that is really focusing on technology, or you are more lifestyle, let's say. But that doesn't mean that one excludes the other. I think it's really important that in terms of your positioning, that you are clear on who you are and what makes you unique. But of course, that still means that you can appeal to ones outside of your segment. And I think especially also if you think about it, let's say if we now take B2C as an example, it can also be part of your growth strategy. So I would say anyway, when you enter with a new product or a new ingredient to the market, where a lot of companies go wrong is that they go mass market right away. And that is where, like, consumers maybe don't understand your product, but that is also where, if you have an ingredient, where you become more of a commodity. So first focus on your core, and then see where you can or how can you make that appealing for potentially other segments. But as a positioning, important to stick to your core, I would say.
Thank you. Is that, Danielle, I'm curious, does it resonate more with you as a journalist when people are positioned on one market versus, like, being sort of that kitchen sink approach of being all for all?
Yeah, I do think that having a niche or a specific segment that you're focusing on makes a difference. And to be honest, it makes it a little bit easier to research and write about too.
For sure. Devon, when you are looking at, because I think a lot of companies come to you and say, like, we don't know what to do. We want to position our product, or we need your help. Like, how do we formulate an ideal product, et cetera? How do you look to that? Like, how do you approach that? And then how do you help? I think sometimes you also help match ingredient suppliers with brands.
Absolutely. We really, at Step Change, we have this ingredient 360 process that we go through, where we're looking at the regulatory landscape, looking at the ingredient functionality itself. Is it heat stable? Is it acid stable? Understanding what applications it can go into, and then understanding consumer trends, and also digging into clinical trials, whether that's by the ingredient company themselves, or if there's, borrowed literature out there, in the science sphere. So trying to put that all together, and figure out what is the type of product that's most likely to be viable from a retail standpoint. And does that ingredient have the legal and the technical ability to be in that particular application? That's sort of what we go through to help figure out where ingredients can be best utilized.
Thank you. Chris, as one of the few suppliers in the industry, and I'm hopeful that there are more very soon, but as one of the few that is doing research on women, how do you partner, if you're willing to share, how are you helping support your brand partners with the science that you guys have, or helping them source ingredients, et cetera? Because you guys have a really rich portfolio of ingredients with a lot of history. You know, this has been an important area for your founder and head of the company. So just curious, how do you approach that with your brand partners?
Well, there's really two tracks with brand partners, the brands that are out there. It's really deep discussions about what do you want in terms of a product. As an example, most people these days are saying, we want something for menopause. Well, okay. Are you focusing on, to earlier points, is it peri, post? Where in the spectrum do you want the ingredient, and what do you want it to do? What symptoms do you want to provide help with? It takes a little bit of time, but if you do that first, you know what you're researching when you develop a supplement. We use AI to make our job a little bit easier in terms of Ayurveda. So once we get the true benefits that you want, we can search within AI, find something, but then you have the second layer of how do you want it to deliver it to the consumer? Is it in a pill? Pills are boring. Does it need to be enjoyable? Then you also have to look at the flavor profile, because a lot of things that come out of Ayurveda specifically don't taste very good to a North American audience. So now you have to, I don't want to say manipulate it, but you need to solve that challenge. Most of the time where we arrive at is you take something that's traditionally 2 grams and compress it into 100 milligrams. That doesn't necessarily have as big of a flavor impact as 2 grams of something that's quite pungent. Now, does it work in a gummy? To Dylan's point earlier, does it work in a drink? Where does it work? So what we're trying to do once we get to a benefit, construct a study, but before we launch the study on an ingredient, we want to make sure that it's very utilitarian in its delivery. Consumers don't want to just take pills all the live long day. They want to take pills, they want to take stick packs, they want a gummy, they want a lozenge. Met somebody recently who put one of our products on Pop Rocks, which is fun. They actually tasted very good, despite having some very pungent things in it. So we're thinking about all this as we develop products. It's not just the science. The science has to be there before we launch a product. But we also need to deliver that science to the consumer, and not everybody wants to take a pill.
That's true. Not everybody does want to take a pill, although capsules, I think, are still the top delivery format for most. And Linda, you've actually done that, right? Like you realized there was a need for this, but you didn't launch with a pill. You have essentially like a food for people to take, which is more palatable. And I'm curious to see kind of how you arrived at the format that you're offering, and then just in general, how important format is for this market.
Yeah, so that's a great question, and also a good call out. So we actually play in the food space rather than the supplement space. And that was specifically because of that customer discovery that we did. So even before we started the company and I started basically formulating products, I spoke to over 100 marathoners, female athletes, to kind of understand what they were dealing with, kind of what products were they looking for, where were the biggest issues in terms of ingestibles that they were having. And to your point about sponsoring porta potties, what called out to us was that when we started, we were interviewing both men and women. Guys are great, but they were saying, oh, when it comes to nutrition, I eat what's on the race course, or I eat what I've done in high school and college. And I was like, good for you. Every single woman we spoke to had to go through boxes of product to find something that didn't make her physically sick. And we're talking about headache, nausea, vomiting, diarrhea, all throughout the course of a 26-mile marathon, which, like, I don't want to do that watching a movie marathon on the couch, let alone running a marathon. So to the point that Devon made earlier, we actually correlated the current products that were on the market, which were in the form of energy gels that a lot of athletes were using, with the research that was available on female athlete macronutrient metabolism. There's a lot of great research out there by Dr. Abby Smith-Ryan, Dr. Suzanne Kleiner. They're both incredible. If you see their name on a study, like, that is a great study. But we did that to do our first energy gels, which are essentially fruit and vegetable-based purees, but doing it in a way that we know aren't going to cause those GI side effects that so many women encounter. And we went the food route because so many of the athletes told us that while they do take supplements, they have a hesitancy around it because of the proprietary blend language that they, especially to either as they're going through pregnancy, breastfeeding, as they're getting older and needing to take new medications, they have this like fear around what are the actual ingredients and the dosages in these supplements. And then Danielle had mentioned it before, but really excitingly, Q1 of 2025, we're releasing a protein powder. That's a protein powder set focused on the menstrual cycle, which I'm excited about. And that has gotten so much traction that actually later in 2025, we're releasing one that's focused on menopause. So we're able to really start focusing on, I know, Devon, I'm so excited. The focus on all of these different life cycle phases, just so that way women understand that we are speaking to them, that we do understand. And I'm still having customer interviews every week. It's something that's so important as you're formulating or as a brand bringing a product to market. And even as an ingredient supplier, I still highly encourage. And to Chris's point, there are so many opportunities as brands to work with ingredient suppliers on different levels of research that then you could say as a brand, like, hey, I'm willing to be the first company that brings your ingredient to market. So many of these opportunities that I think sometimes we don't think about as a brand.
Yeah, I think that's really important. And the more science we can get out there and collaboration opportunities, I think can be really helpful for this industry. Danielle and Marit, are you seeing any data related to product format at all from a positioning standpoint, or like any trends, Danielle, that any interesting or innovative formats that have come across your desk in this market?
Yeah. Traci, I think not just women, I think everybody kind of has pill fatigue. So a lot of us are exploring other formats. Drinks are great. I know, Marie, you mentioned the different consumer segments, and in the Better For Me segment, they're driven by convenience, you mentioned. So I think convenience really is the name of the game, especially for women. We are not only, we're working, we're driving our kids to practice and, appointments and things. We're on the go, we're going to the gym. And so we need something convenient. Gummies are cool, but I think the next thing to be on the lookout for are chews. I think chews really are going to be the next gummy.
I think it's fine that you mentioned that, because I wanted to say something exactly the same, because I think gummies, they really allow us to have supplements easier, but also come with a lot of challenges in a way, because usually they're full of sugar. It's not that you want to give 5 of those gummies in the end, maybe to your kids. And I think we worked actually with Concordic Supplements. They are a B2B company, and they do indeed more like chews, but soft chews. And it's really about also understanding how your body is absorbing the nutrients. And I think this is something that is going to be important for all the formats, is that how it reflects the absorption of the nutrients in your body, and the efficacy of that. I think that will be really important.
Do you think we just had go ahead, Devon, and then I have a question that just came
question that we just got. Gummies are think of like fruit snacks, gummy bears. Or sorry, I should say the question, the difference between chews versus gummies. I think consumers might know the difference. We in the industry definitely do. Gummies are, like fruit snacks, gummy bears, gummy worms, all the fun things that we like to eat at the theater, right? Chews, think Starburst. A lot of the Concordix comes in sort of like a pill pack type deal. But there's a lot of chews out there, and nutraceutical chews that are individually wrapped, just like old school Starbursts. And I love that Danielle brought that up. The one thing that's nice about the Concordix soft chews and, Starburst type chews in general is they're more portable. So, and you can pop one in your purse or your gym bag or whatever and not have to worry about it sticking to something. Whereas gummies, even the best formulated gummies will still get squished and can stick to things. So the choose add an extra layer of portability, which could be important if the active that you're formulating in there, maybe it's something that's time sensitive, or maybe, something like if it's nausea and you have a ginger chew, you only take it as needed, that sort of thing.
Thank you. We had a question come in, and I'm not sure if any of you will be able to answer or not, but I do want to try to tap into it, related to a lot of startups, right, that might be related to women's health, et cetera. When you're going after investors, you're pitching that to men versus a female-led investment firm. There aren't that many of them, and that actually will be a topic of a WIN webinar next year. We're going to be looking at how to get more investment support from that industry. That will be a topic we cover in 2025. So everybody watch out for that. But as if any of you can weigh in to help this person in terms of, she has solutions for the elimination of PMS disorders, right? But she's pitching it to men. And so, Chris, not every man is like you, where you are very open to it. And I remember supply side, you said to me, like, hey, I just want to make sure that people like my wife have the support that they need, and I want to do everything I can to do that. But Linda, this is probably primarily for you. I'm imagining that you've probably had a pitch to some male investors. How do you deal with that?
So many male investors. Wow. And what's funny too is, so I mean, my company is focused on female athletes, and when we started doing pitches and even pitch competitions in 2021, the first comment I would get after I did like my pitch and it was all like buttoned up and cute and like perfect, would be like, this is nice, but really, how many women are athletes? And I was like, it like feels like you're taking like a back to your knees and you're just like, what? So to Devon's point about how women actually are the primary consumers of the household, as per the U.S. Department of Labor, the purchasing decisions in the household, 70-80% of them are made by women. So what I started to do was actually incorporate those types of questions within my pitch deck. So that way there was no question towards the end of that pitch that there is a market for women. And so, like, for example, for marathoners, right? Women in the US make up over 47% of participants in US marathons, with the rate of participation actually outpacing that of men. So within the next 5 to 10 years, the majority of marathoners will actually be women as compared to men. And so it's having that type of like data right available, because you will get those questions and it's like, oh, it's all good. Here, I got the answer for you. No problem. And so it's how are you reframing it to your audience? And I think too, do as many pitch competitions as you can. You learn so much. You understand what the questions are going to be. It's a great way to start funding. It also then legitimizes in a lot of ways to investors as well, of like saying like, oh, I was a finalist for X and Y pitch. I, got award money from this pitch that helped me fuel this level of development. And you don't know what you don't know until you put yourself out there.
Thank you.
Yeah.
Just to add on to that, I would say, bring a man with you. Bring a male with you when you're pitching. If you don't have someone on your team, bring your brother. Just bring some type of male with you, because just having that presence there increases your chance of getting an investment like threefold, or don't quote me on that, but something crazy like that. I was just listening to a podcast recently and they were talking about that, and it just was astounding to me, just the idea of just bringing a male with you, what a difference it makes when presenting your business to potential investors.
Yeah, hopefully one day we won't need that. Devon, I can see your face being like, I don't like that. And I agree. None of us like it, but I think Danielle is getting very practical that if you want it for now, that's what you got to do. And down the road, we're not going to have to, but for now, I think it's a really good piece of advice.
No, I'm just remembering I used to get that advice for negotiating when buying a new car. I never thought about it. So
And
starting a company.
just to point out too, the investor pitch is as much of an interview for them as it is for you of them. you are entering into a relationship with them. And sometimes, like I've heard horror stories of it being like a horrible marriage and you're like, I wish I got a divorce from this, but it is a process. And don't ever forget that you have something that's of value to them and that it's worth that value. So if you're getting this vibe of like, this guy doesn't get it despite me sharing how great my company is and how much of an impact this is going to make, tough cookies for them. Like they lost. That's fine.
Love it. Marie, you wanted to add something, and then we are coming up to the end of our time. So I do have another question for you all, but Marie, I want to give you the chance to weigh in as well.
Thank you. Yeah, I wanted to add to this because we have experience also with this. We worked with a female scientist founder who wanted to launch her supplement for migraines, a very intelligent woman. But her problem was that the topic and the science behind her product was very difficult to explain. And now this startup Pink Matter, I don't know how deep you go into the science, but this was for her really the problem why she couldn't get investors on board, because it was such a complex problem. And again, it's also a problem that is mainly for females. So for her, what has really helped her is really creating the belief. So rather than focusing too much on the scientific data, which is still very important, not to say that it's not important, but it's really about creating the belief in the founder. I think that is really important. And this is where she was able to share her personal story that's so many other women in the world shared with her. So it's really, creating the belief in the founder, in you. I think that is what my advice would be.
Thank you. So we are coming up to the end of the time for today, but I would be remiss if I didn't ask you all about maybe 1 to 3 ingredients that you think are really key for this market that people should be considering as they're thinking about, formulating in 2025 and beyond. So Devon, I'm going to start with you.
Sure. I'll share the same 2 ingredients I shared at the panel on Supply Side West.
That's okay. They're good ones.
Ashwagandha and saffron. Ashwagandha is a nootropic, which can help with cognitive function, and it's also an adaptogen, which helps your body deal with stress. And what speaks to women more than needing to be on our A game with everything that we do and needing to deal with a lot of stress. So big fan of ashwagandha. And saffron actually has been studied on women, perimenopausal women, which Traci keyed in about how open I am about my life. And I'm definitely in that phase of perimenopause. And saffron can help with relaxation and mood, sleep, can help with climacteric syndromes, which are those fun hot flashes, and irritability and lack of sleep and fatigue and all the fun stuff that we as women get. I would also say anything to do playing into the gut axis. So gut immune, gut brain, gut muscle, gut heart. There's so much that we can do with the gut to modulate what happens elsewhere in our body. So, and we're seeing a lot of probiotics out there that are geared towards women in general, from a health or digestive and immune perspective, but also the vaginal microbiome. So looking for those ingredients, I think, in the next year.
Thanks, Devon. How about you, Danielle? Some hot ingredients you think for this category?
Yeah, just to piggyback off of what Devon said, probiotics all the way. Just speaking from myself personally, I've been taking them for a long time. I have IBS, and a lot of women are disproportionately impacted by IBS. So that's a key part of it. Vaginal health, hormone balancing. Some of us are more prone to UTIs. So I'm all about probiotics. And that's, when women ask me, like, what's the one thing that I take, that is the one thing that unconditionally I always have to take, and I assume always will.
Awesome. Thank you. Marie, how about you?
Yeah, I can agree with a lot of these supplements, and also thinking about supplements that I take myself. I'm a big fan of ashwagandha as well for lowering stress, because I feel it works. It really works. I would say also mushroom ingredients. I'm a really big fan of those, and I think they have a lot of potential. Especially, I've been taking lion's mane myself for cognition, mental clarity, and again, I feel it helps. I think probiotics are really good, but I would actually like to add postbiotics here. is also something I've been taking, and we are working together with a postbiotic company. And it's really, really promising to see how this is, relieving really these IBS symptoms, but also how it can support consumers that have IBD. So I think that's also a very promising new area in the biotic space.
That's perfect. Thank you. Chris, I'm over to you.
Well, I'm going to give, excuse me, I'm going to give a shameless plug, but
absolutely. Go for it, but make it quick.
I guess to make it to the most exciting ingredients, one, it's an ingredient called Shibari 4. If you like ashwagandha, keep in mind the science is a unisex solution for stress. Shibari 4 is more of a women's focused solution for stress and hormone imbalance. The other is, I can't actually tell you what it is, but it is a prebiotic designed for a younger, kind of 20 to 35, predominantly women. Yes, it will work on men, but our study design will be solely on women to start.
Awesome. So that's something we should keep an eye out for.
Yeah. Stay tuned.
And Linda, how about you?
Actually, Danielle had mentioned it before, but lactoferrin. There's some really exciting work coming out on lactoferrin. Lactoferrin is highly researched in women and researched in women too, in regards to women who are pregnant and breastfeeding. It has great capabilities in terms of iron absorption and utilization for red blood cell development. We are excited to be working with Helena on their human lactoferrin analog made from a vegan base, which is really, really exciting. The majority of lactoferrin you will find on market is bovine. So we're excited to basically open up that opportunity for women who aren't meat-based eaters. And then outside of that as well, have to kind of do a couplet is always making sure iron. And that's part of my my whole pitch too, as a family medicine physician. A lot of women are underutilizing their iron consumption. And then as well, there are a lot of issues in terms of iron absorption. So if you can ensure that your product is bringing in iron absorption, I think that you are on the right track.
Perfect. Thank you. Also, as a mineral ingredient supplier, I appreciate you bringing up iron. So our time is up. I could talk to you all day, and I think we could cover so much more, and we'll probably dig deeper into this topic in the future. But for now, Chris, Danielle, Devon, Linda, and Marit, thank you so much for sharing your expertise with our audience. We appreciate it. We're going to be doing a series of webinars in the future, but I will tell you all that if any of you are available next Thursday, we have a WIN Town Hall, our 2024 year in review, and look at what's ahead. Our president, Heather Granado, executive director, Rebecca Takamoto, and Chair Karen Todd will be speaking. And then we're opening it up to you guys for networking, connecting, getting questions answered. So I hope that you will try to join us. I think my colleague dropped the link to this in the chat. So you can click that to register, and it'll also be in the WIN newsletter and up on WIN Social. But for now, thank you again so much to our panelists, our experts, and thank you to all of you for attending today and investing an interest in this topic. So thank you, and we look forward to connecting with all of you again soon. Have a great day, everyone.
Thank you.
Thank you.
Thanks.
Thanks.
Thank you.